very funny that there are groups within South Africa who say they are there to die for the constitution and protect it, but they are not prepared to die for this. It's not written by me, it's in the constitution which everybody accepted, section 27, that everyone has the right to have access to health care services, including reproductive health care, sufficient food and water, social security, including if they are unable to support themselves and their dependents, appropriate social assistance. The state must take reasonable legislative and other measures within its available resources to achieve the progressive realization of each of these rights, and that no one may be refused emergency medical treatment. This is not happening. There are people who have been refused emergency medical treatment because they can't pay. But it's on the Constitution. Where are the defenders of the Constitution on this issue? So the issue of making sure that there is reasonable legislative and other measures for people to exercise a right to health care is not a choice by the Minister of Health. It's an obligation on my shoulders placed by the Constitution of the country. Only that we're not doing it. And the concept of social solidarity, which will be debated forever, and equity. These two, when Bishop Tutu just mentioned something about it, it started a raging countrywide debate. The issue of social solidarity and equity we can't run away from. One of the reasons we can't run away from is here. When you come to equity, is here. This is the Gini coefficient, the gap between the rich and the poor. There is South Africa. All these countries are below us. 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 We are a country with two poles. And if South Africans, and every time people believe we are threatening them, this is a reality. This is the reality. That the inequality is so big that there's no country in the world that compares with us. And we believe, I'm not asking people to share their houses with the poor, give them some of their many houses which we have got. I'm not asking people to share their salaries with the poor. I'm not asking people to give some of their cars to the poor for the Gini coefficient to close the gap. I'm just asking them, please, let's agree to take care of them when they are sick. Let's do so. And that's what NHI is all about, at least for their health. Why? Because there are socio-economic benefits to healthcare. Because people who are healthy are more productive economically. Because what I've shown you about HIV/AIDS, I didn't put the farms here. And South Africans are sitting on their tables every day smiling and eating. I see disaster coming and it scares me. We have not yet moved in the farms and I've shown you. I've got farms around this country where 90% of the farm workers in one farm are HIV positive. It goes as high as 90%. Those which we believe are lower is if 50% are negative. How is that farmer going to sustain and produce food for the country? How is the economy going to run? We have got the mines also. At the moment, the biggest killer in the mines, I was hoping to have the slide here, but it looks like I left it because I didn't show it. But the biggest killer in the mines is no longer pneumoconius, etc. It's TB. To an extent where in November, unless it has been postponed, the World Bank and the World Organization has decided